5 years ago, Idaho voters approved expanding Medicaid for Idahoans that made too much money to qualify for standard Medicaid, but not quite enough money to get help on Idaho's healthcare exchange. In that bill was a requirement for a 5-year assessment of what the program has done so far, which is where we are now. This week, both the House and Senate Health and Welfare Committees are asking questions of the fine folks who work at Idaho's Health and Welfare Department. Things like how much money, how many people involved, and those answers will help lawmakers make recommendations about what to do with Medicaid expansion for the future. Joe Paris is following the hearings, the conversations, and the questions that are being asked on Medicaid today. Joe, what seems to be like the major question right now that lawmakers are wanting to know?
Well, Brian, the cost and performance of Medicaid expansion is really what this is all about, this conversation. We've heard in recent months and weeks from lawmakers who have expressed concerns about the overall cost of Medicaid expansion and the amount of money going into it from the state and the federal government. Now, this week, Juliette Sharon, the Medicaid Division Administrator with the Idaho Department of Health and Welfare, she is presenting information and answering questions from lawmakers, and she acknowledged that, yes, Medicaid expansion is costing more than originally projected in 2018, and a major factor into the cost of expanded Medicaid is a federal rule throughout the COVID pandemic that kept people enrolled on Medicaid even if they may have lost eligibility. But soon, on February 1st, here basically in a week, Idaho will be able to reevaluate the Medicaid rolls and begin purging some people who are no longer eligible for expanded Medicaid. And the expanded Medicaid group that could be removed is approximately 67,000 people, according to the Department of Health and Welfare. Now, the expanded group sits at about 145,000 right now, so that's 67,000 people. It's about half. It's a good chunk of the people that could be removed from the program, and that would bring down costs, as you would assume. But let's look together at the Health and Welfare Medicaid expansion budget. You'll see from the state fiscal year 23, or SFY 23, to state fiscal year 24, request dollars, the total cost of the program did go up by several $1 million. That's that top number for you. But the general fund request, and that's money that comes from the state of Idaho, that request is slightly lower in 24 than it is for 23. But there are still questions, though. Why did the cost go up if Idaho expects to purge thousands of people from the program?
If I lost 60,000 people on Medicaid expansion, why is the dollar amount higher?
Mr. Chairman, so in the SFY 24 request, we see a reduction in the general fund, but we see an increase in the federal and dedicated. And the federal and dedicated are supporting the upper payment limit payment to hospitals, the supplemental payment to hospitals. Again, it's the difference between what Medicaid paid and what Medicare would have paid. So we're now implementing that payment for the expansion population. Now that we have full years of reimbursement data for hospitals, it will be incorporated, and that is why we see the increase in the budget, even though the number of eligibles will likely decrease in this next year.
So, Sharon, answering that question from Representative Vander Woude. So reimbursement money to providers is now revving up now that the expanded Medicaid program is up and running. Now, today in the House Health and Welfare Committee, that concept was detailed by Sharon. It led a few lawmakers to question the review happening right now.
We've implemented Medicaid expansion here in Idaho just a couple of months shy of the start of the pandemic. And so I certainly think that we see some of these costs corresponding with care that has been provided during the pandemic, and then care that had to be deferred because providers were not able to do elective surgeries or some services during the pandemic years. So we have not seen probably what will be normal utilization yet in the program. I think we're still in a period of normalizing, be it the caseload as we work through redeterminations, what utilization will be in the program, and settling in the program. We have seen an increase in the population, and we have seen, as I've mentioned, a higher utilization rate than we projected. That is certainly true, but I do think that we are still in a space of settling in the program as we come out of the pandemic years.
Maybe we should wait a couple more years and review this process and let things more normalize, and then be able to see how this program is benefiting
Sharon was asked a lot of questions about cost, and she did say that if you do consider all the costs and benefits of Medicaid expansion to Idaho's budget specifically, it would cost Idaho more money, about $10 million, to end Medicaid expansion rather than keeping it. Now, a lot of great questions from lawmakers this week, and Health and Welfare is working to get numbers and data and answers to all of those before lawmakers will write their recommendations. And Health and Welfare was asked about how they could cut costs, and there's actually a big report into that, which will soon be presented to Idaho lawmakers, Brian. And I do want to say, though, as you heard one of the lawmakers talk about, maybe we should wait a few years to take a look at the review. Well, by law, the state of Idaho, the lawmakers, they have to take a look at it this year, 5 years after it passed in 2018. So they don't have an option. They have to write a recommendation, but the recommendation, it'll depend on what lawmakers think about it. Health and Welfare working this morning in the House, this evening in the Senate. So we'll find out in the coming days really what this looks like. They have till January 31st, the end of the month, to get those recommendations written in. And we're still waiting to hear exactly what those recommendations will look like in terms of if it'll be one letter from a joint Health and Welfare committee or if it'll be individual from the House and Senate.
Okay, so that 2018 law, though, obviously they couldn't have foreseen a pandemic be thrown right in the middle of that 5 years. So I can understand why they say, well, let's wait till normalize a little bit. But the other side of that, it seems like we're going to be getting more federal money to kind of cover that. So it's still a lot of undecided things or a lot of unclear aspects going forward.
Right. And, even with the federal money, and if you haven't learned about Medicaid expansion in Idaho, for every dollar that's spent on it, 90 cents essentially comes from the federal government. Right. Idaho will kick in 10 cents per each dollar. The federal funds, though, there are some lawmakers that say, it doesn't really matter if this is federal funds or state funds. We're seeing this program costing more and more than we really thought it was, and we'd like to see the costs driven down. Dave Jepson, who's the director of the Department of Health and Welfare, he was asked by Chairman Vander Wouda, what are some short-term and some long-term things that you could do to cut down on the cost of this? And really, the logical thing is cutting programs and cutting some services. So we'll see if things like, extra dental care could be on the chopping block.
Wouldn't that be a direct correlation to how much medical care costs, though?
Yeah, and that is also into the equation as we chat about it here on the 208. There's a lot that goes into this, and everything we talked about, even more, is available right now in a great article at ktvb.com.
Thanks, Joe. All right.